Hello, everyone. I'm Dr. Emily, family medicine physician, and this is the Well Age Insight video podcast, where we discuss common health problems that affect people over age 60 and the best ways to prevent and manage those problems. In today's episode, I want to review the basics of the most common chronic condition that affects older adults. It affects an estimated 70% or more of older adults, and that is high blood pressure, also known as hypertension. So this is a really common condition, and since it's so common and also so common for older adults to be taking medication for it, I'm going to do a little series of episodes so that if you have high blood pressure, or you might have it, or if you're taking care of somebody who has it, you can understand this condition better. And so in this particular first episode, I'm going to start by covering really the basics of blood pressure, including what it means to have normal blood pressure versus high blood pressure, how we define hypertension, why we want to treat it. And then in an upcoming video, I'll go in depth into how we might treat high blood pressure or otherwise help people lower their blood pressure. And I'll also probably do a different episode on low blood pressure itself, since that also comes up in geriatrics as well. So specifically in this video, I'm going to start by covering what is normal blood pressure, sometimes abbreviated BP, versus high blood pressure in older adults. I'm going to talk about how hypertension is defined and how we measure blood pressure when we're trying to diagnose hypertension. I'm going to talk about what causes high blood pressure, what are the signs and symptoms of hypertension, why it's bad for your health, how high is too high when it comes to blood pressure and when to treat. And then I also want to talk a little bit about what the guidelines say we should aim for when it comes to blood pressure and the idea of goal blood pressure if you're treating aging adults. And then I'm going to finish with some suggestions on what to do if you are concerned about blood pressure. So let's get started and talk about blood pressure. But before I get into that, I have a very quick request, which is that if you are here and you find this topic interesting, or you've been finding my videos interesting, if you haven't subscribed yet, could you please go ahead and subscribe? It would just mean a lot to me. And it really helps me out when people subscribe. It helps other people find the channel, and it helps support the work that I'm doing. Thank you so much. Okay, moving on again. So let's get started. So what exactly is blood pressure, right? What is blood pressure? Every time your heart beats, it pumps blood through your body. That blood pushes against the walls of your blood vessels, and that push is called blood pressure. It's completely normal. Your body needs this pressure to keep blood moving and delivering oxygen to every part of you. But here's the thing. When that pressure stays too high for too long, it becomes a problem. When you get your blood pressure checked, you'll see two numbers. The top number is called systolic pressure. That's the pressure when your heart beats. The bottom number is diastolic pressure. That's the pressure when your heart rests between beats. A healthy blood pressure for most adults is usually around 120/80 or lower. Medically speaking, doctors in the United States generally say you have high blood pressure when your readings are consistently at 130/80 or higher. If your numbers reach 140/90 or above, that's considered stage 2 hypertension, and it definitely needs attention. Now, you might be wondering, why does this matter so much? Why should I bother treating it, especially if I feel just fine? That's a wonderful question, and it's one of the most important things I want you to understand today. High blood pressure is often called the silent killer, and that nickname exists for a very good reason. It can quietly damage your body for years, even decades, without giving you any warning signs at all. By the time symptoms finally appear, serious harm may already be done. That's why catching it early and treating it is so important. It can literally add years to your life and protect the quality of those years. Now let's talk about what causes high blood pressure, especially as we get older. Aging itself plays a big role. Over time, our blood vessels naturally become stiffer and less flexible. Think of a garden hose that's been left out in the sun for many years. It loses its bounce and becomes rigid. Our arteries can do something similar. When they're stiffer, the heart has to work harder to push blood through them, and pressure goes up. But aging isn't the only cause. Several other things contribute too. Family history matters. If your parents or siblings had high blood pressure, you're more likely to develop it. Carrying extra weight can put additional strain on your heart and blood vessels. Eating too much salt, which is found in many processed and packaged foods, can raise blood pressure significantly. Not getting enough physical activity, drinking too much alcohol, and smoking are all major contributors. Long-term stress can also play a role, and certain medical conditions that become more common with age, like diabetes, kidney problems, and sleep apnea, can all push blood pressure higher. Even some medications, including some over-the-counter pain relievers and cold medicines, can raise it. Now, here's something really important to understand. Most people with high blood pressure feel absolutely no symptoms, none at all. They feel perfectly healthy. They go about their day, take care of their families, enjoy their hobbies, and meanwhile, their blood pressure is quietly damaging their body. Some people may occasionally experience headaches, dizziness, blurred vision, chest discomfort, or a feeling of a pounding heartbeat. But these symptoms usually only appear when blood pressure has reached dangerous levels, and even then, many people don't notice them, or they blame them on stress, getting older, or being tired. This is why so many older adults walk around with high blood pressure for years without knowing it. They feel fine, so they assume everything is fine. But trust me, the only way to truly know is to have it measured. Let's talk about why this condition is so dangerous, even when it doesn't make you feel sick. Imagine water flowing through a pipe at very high pressure, day after day, year after year. Eventually, that pipe is going to wear down, develop weak spots, and possibly burst. That's similar to what happens inside your body when blood pressure stays high for a long time. Your heart has to work much harder than it should. Over time, the heart muscle can grow thicker and weaker, which can lead to heart failure. Your arteries become damaged and develop tiny tears, where fatty deposits build up. This narrows the arteries and can eventually cause a heart attack or stroke. Your brain is especially vulnerable. High blood pressure is one of the leading causes of strokes. It can also slowly damage the small blood vessels in the brain, which over many years can contribute to memory problems and even dementia. Your kidneys can suffer too. They have tiny, delicate blood vessels that filter waste from your body. High pressure damages these vessels, and over time, the kidneys can stop working properly. Your eyes can also be affected, leading to vision problems and even blindness. And here's the heartbreaking part. Most of this damage happens silently. You don't feel it happening. You only notice when something serious, like a stroke or a heart attack, suddenly strikes. This is exactly why it's so important to stay aware of your blood pressure, even when you feel perfectly healthy. Don't wait for symptoms. Don't wait for a warning sign. The warning sign for high blood pressure is often the disaster itself. So what are the specific risks of leaving high blood pressure untreated? I want to be very clear because I think it's important to understand exactly what's at stake. Untreated high blood pressure significantly raises your risk of heart attacks, strokes, heart failure, kidney disease, vision loss, memory problems, and dementia. It can also lead to a condition called peripheral artery disease, where blood flow to your legs becomes restricted. Now for the good news, and there is plenty of good news. High blood pressure is one of the most controllable health conditions we have. With the right habits and, when needed, the right medications, you can absolutely manage it well and protect yourself from these serious outcomes. Let's talk about the daily habits that make a real difference. First, pay attention to what you eat. A diet rich in fruits, vegetables, whole grains, and lean proteins can lower blood pressure naturally. Many doctors recommend something called the DASH diet, which simply stands for Dietary Approaches to Stop Hypertension. It focuses on these healthy foods while cutting back on salt, sugar, and processed foods. Speaking of salt, please pay close attention to how much sodium you consume. Most older adults eat far more salt than they realize. It's hiding in canned soups, frozen meals, deli meats, breads, sauces, and snacks. Try to aim for less than 1,500 milligrams of sodium per day. Read labels. Cook at home when you can. Use herbs, spices, garlic, and lemon to add flavor instead of salt. Stay active. You don't need to run marathons. A brisk 30-minute walk most days of the week can do wonders. Gentle activities like swimming, gardening, yoga, or Tai Chi are all wonderful for older adults. Always check with your doctor before starting a new exercise routine, but the bottom line is, move your body regularly. Try to maintain a healthy weight. Even losing just 5 or 10 pounds can lower your blood pressure noticeably. Limit alcohol. For adults over 60, the recommendation is usually no more than 1 drink per day for women and no more than 1 to 2 for men, and even less is better. If you smoke, please consider quitting. I know it's hard, and I'm not here to lecture you, but smoking damages your blood vessels and raises your blood pressure every single time you light up. Your doctor can help you find ways to quit that actually work. Manage your stress. Find activities that bring you peace, whether that's reading, prayer, meditation, time with grandchildren, music, or simply sitting quietly with a cup of tea. Chronic stress raises blood pressure, so finding healthy ways to cope is essential. Get enough sleep. Most adults need 7 to 9 hours per night. If you snore loudly or feel exhausted during the day, talk to your doctor about sleep apnea, which is common in older adults and is closely linked to high blood pressure. Now let's talk about how treatment may be different for adults over 60 compared to younger adults. Doctors often take a slightly different approach with older patients. As we age, our bodies process medications differently. We may be more sensitive to side effects. We may already be taking several medications for other conditions, so doctors need to be careful about combinations. Sometimes blood pressure goals are slightly adjusted for older adults, depending on overall health, other medical conditions, and how well someone tolerates medications. For some healthy older adults, the goal might be below 130/80. For others, especially those who are frail or have many other health concerns, the goal might be a bit higher to avoid dizziness and falls. That's why it's so important to work closely with your doctor. There isn't one perfect number for everyone. Your treatment should be tailored to you, your health, your lifestyle, your goals. Common medications used to treat high blood pressure include diuretics, which help your body get rid of extra salt and water. ACE inhibitors and ARBs relax your blood vessels. Calcium channel blockers also help relax blood vessels. Beta blockers slow your heart rate. Your doctor may prescribe one medication or a combination of several, depending on your needs. If you're prescribed medication, please take it exactly as directed, every day, even when you feel fine. One of the biggest mistakes people make is stopping their medicine because they feel better. Remember, you feel better because the medicine is working. Stopping it lets the pressure climb right back up. Alongside medication, all those lifestyle changes we talked about still matter enormously. In fact, healthy habits often allow people to take lower doses of medication, or sometimes even come off medication entirely under their doctor's guidance. So what should you do if you're worried that you or a loved one might have high blood pressure? The first step is simple. Get your blood pressure checked. You can do this at your doctor's office, at most pharmacies, or with a home blood pressure monitor. Home monitors are affordable, easy to use, and many are covered by Medicare. Check it at the same time each day, while sitting quietly with your feet flat on the floor. Write down your numbers, or use an app to track them over time. If your numbers are consistently high, especially if you're seeing readings of 130/80 or higher, make an appointment with your doctor. Don't wait. Don't assume it'll get better on its own. Don't tell yourself you're too busy or it's not that serious. When you see your doctor, here are some helpful questions to ask. What is my actual blood pressure goal? Do I need medication, or can I try lifestyle changes first? What side effects should I watch for? How often should I check my blood pressure at home? Are there any foods or other medications I should avoid? How will we know if my treatment is working? Bring a list of all the medications, vitamins, and supplements you take. Bring your home blood pressure readings if you have them. And don't be shy about asking questions. It's your health, and you deserve to understand exactly what's happening and why. If you're caring for an older parent or loved one, gently encourage them to take this seriously. Offer to go with them to appointments. Help them remember their medications. Cook heart-healthy meals together. Go for walks together. Your support truly makes a difference. I want to leave you with this thought. High blood pressure is common, but it's not something you simply have to accept as part of getting older. It's manageable. It's treatable, and with the right care, you can live a long, healthy, active life, enjoying your family, your hobbies, and everything that brings you joy. The most powerful thing you can do is stay informed, stay aware, and stay connected to your healthcare team. Get checked regularly, listen to your body, take your medications, make those small daily choices that add up to a healthier heart. You're worth this care. Your health matters, and it's never too late to start protecting it. Thank you so much for spending this time with me today. Please share this information with someone you love. Take care of yourself, take care of each other, and I'll see you next time.